my background is in Chinese medicine. So consequently, the way that I look at health and look at treatment, look at pathologies, look at conditions, look at everything is from a TCM point of view. Okay. So consequently, as we know, we have always two opposites, okay, two opposite forces which collaborate in our body, giving us a healthy condition or giving us a non-healthy condition, okay? I was invited to do a kinesiotaping course in Barcelona. I've never been to Barcelona, so I went to Barcelona and I did this 2-day course in kinesiotaping. Came away and I said, I could not understand anything. Whatever they taught extremely poorly. Okay, the concept was not there. The type of application of kinesiotaping is a stretched application. Okay, you stretch a tape. And I said, well, in my neurological stroke patients, I'm never going to use that technique because it's a stretch technique. If you apply a stretch tape technique over muscle retraction, obviously what's going to happen to the muscle retraction is going to get worse or better. Obviously, it's going to get worse. And so a stretch taping technique creates, obviously, compression, congestion, reduces blood and qi, if we're talking about Chinese medicine, blood and qi flow. And so consequently, that condition would not get better. So I came away from that, and over the several years, I kept on thinking, well, there's something behind. Okay, application of a tape on the skin, which is going to influence all the different layers in our body. So there I use the TCM frame of mind, which means, okay, we have two opposites. You stretch a tape and it comes back concentric. You don't stretch a tape and it goes eccentric. So in 2003, I started to create this concept, which is an eccentric tape stimulation, which means you apply the tape and the force generated, the action generated by the tape is not concentric, but is the opposite, eccentric. Eccentric stimulation in the end is going to dilate the muscle tissue. And basically that's what we're doing. Okay, well, I'm an acupuncturist, and so I have acupuncture clients, which can be stroke patients or more simple muscle tension conditions. And so creating this decompression eccentric concept. So I created an institute, a school here in Rome in 2003. I started out, okay, just with simple muscular tension problems and muscle contraction problems like stroke, etc. But thereafter, so very quickly in 2005, okay, 2005 was the first patient with facial paralysis treated in Italy, around Turin. So consequently, in these last 20 years, I've trained 17,000 people in Italy, which are doctors, mostly physical therapists, nurses, speech therapists. What do you do with a tape in speech therapy? Obviously, you're not going to stretch it in this direction. Otherwise, we're going to have serious ischemic problems. We want to treat those ischemic problems. So if you have a problem created by ischemia, which could be facial paralysis caused by cold, caused by virus, caused by trauma, caused by operation. So consequently, we want to improve nerve conduction. So in that case, we're going to apply a tape which is going to dilate and not compress, dilate. Okay, so consequently, when you do that, you get very quick results. Okay, that's where it started, and so consequently, speech therapy is a big area in Italy. And so that has really started since 2015. So there's lots of speech therapists, and I do 2-3 master courses, university courses. I have a small component in a master course for swallowing and voice problems, university level, for speech therapy. But there, the applications are important after cancer surgery of the tongue, of the thyroid, of the larynx, etc. And so we apply the tape very quickly after surgery, 3 days after surgery, really, to reduce the edema created by the surgical procedure and to help mobility, help with the scarring. And so these are all things that you do manually by elongation. Mm. And so consequently, you apply the tape in the same principle. On oncology is 4 days. So here we're talking about the rehabilitation, really, after surgery, after radiotherapy, and in some cases for neuropathy due to chemotherapy. These courses are going to be the first courses that are done in Australia. Okay, so you will be the first group to have this sort of methodology under your collar, under your shirt, under your hand.